Hi, everyone on Facebook. I hope that you are all ready for a wonderful live discussion today. Welcome and thank you for coming. My name is Krista and I am the administrator with Relivar Home Care. And I'm here with Misty, the owner of Relivar Home Care. Hi, Misty.
Hey, everybody. I want to give a little bit of information about our event today. First of all, this is our first community education session, and we're so excited. One of the things that we realize being in the caring community is that we come across a lot of great companies and great services. However, we seem to keep it within our own house, and a lot of times we're not sharing that information with people. So we had thought, what a great way to, get onto Facebook and share with our friends some of the wonderful services, rehabilitation services out there that we know of, that we've been keeping a secret lately. So today's session, and we're going to talk with Polly Swingle, who is a co-owner of the Recovery Project. And it should be about right around 30 minutes, but I guess it all depends if you all have questions. And, if you do have questions, we want to be able to answer those when you have them. Krista's going to be there for us to kind of bring up whatever questions you might have for Polly, for myself, or Krista on the services of care and therapies that are out there. You've got, some really smart people here in this room that could assist. So when we get done with this, we will be posting it up. Obviously, it'll be on our Facebook page, but we'll also be posting it up on our YouTube channel, the Relivar Home Care YouTube channel. And I believe, Polly, you had mentioned that you'll probably put it up on your page as well. So without further ado, I want to introduce Polly, who is an amazing person with lots of great information. They have so many programs at the Recovery Project that we kind of had to narrow this one down. We have a future one coming up. And today she's going to talk about spinal cord rehabilitation. So Polly, I'm going to hand it off to you.
Great. Well, thank you, both of you. So I am super excited to join you guys today and have this opportunity to talk about spinal cord injury. And, I want to give you a little bit of background. So I am a PT and I've been a physical therapist for over 35 years. And I started the Recovery Project 18 years ago and have been in the field forever and have worked with spinal cord injury from the very, very beginning when I graduated from college, and have had this passion for neuro rehab and had this really great opportunity 18 years ago where I was working with this patient. And this gentleman had a spinal cord injury. And at that time, so this was 2003. And at that time in spinal cord injury, especially in rehab, there was very, very little science behind what we were doing in rehab and if it was working. Now, shockingly, being in medicine, that when I first started in physical therapy, there was very little science to prove what we were doing in physical therapy if it was working. It was just always like, well, we know we got to move these people, so let's get them to exercise and let's hope that they show some recovery. So I was taught in school that if somebody had a spinal cord injury, now remember guys, somebody that has a spinal cord injury usually has some form of paralysis, right? They can have a complete injury where they may not be able to move anything from the waist down. They may have an incomplete injury where they're sparing and they may have some weakness in their wrist and hands. They may then have some weakness in their hips, knees, and ankles, maybe some bowel bladder issues, but it's incomplete. But what we were taught in school was you're only going to exercise what an individual can move. There's never any science behind it. That's just what we were taught. So if somebody came in and they couldn't move anything from the waist down, they were in a wheelchair, as a physical therapist, I'd be like, all right, I'm just going to strengthen your arms and teach you how to move your body with your arms. Well, let me tell you, that changed when science came. And when I was treating this gentleman in 2003, science started coming out. And there was some research out there that came out with cats. And with those cats, they suspended this cat over a treadmill. And this is really terrible because I love animals. But what they did
Me
is,
too.
okay, I know, me too. But what they did is they severed the spinal cord of this cat. And they suspended this cat over the treadmill. And they were like, let's see what happens. And the thought process was, is somebody in science that's way smarter than me found out that there were these reflexive nerves in the spinal cord that when they severed this cat's spinal cord and they put him on a treadmill, the treadmill was going, that the cat automatically started stepping. So there's this whole revolution where it was like, huh, so maybe we can try to exercise below that level of injury that we saw in the MRI, whatever, you know, that was first when they were first injured. So make a long story very, very short. What they discovered is that especially people that have an incomplete injury, so meaning people that have some sparing in their spinal cord, that we learned that forcing people to move below that level of paralysis, people were showing recovery. So the gentleman that I was working with in 2003, the science started coming out. And in this facility that I worked at, they had this harness system that they used for people that had herniated discs. So what they did is traction them with a harness. They'd have them walk over a treadmill with a theory that if we can open up that space between the vertebrae for a herniated disc, you're going to have less pain. So I read this study about this cat, this gentleman, 6'4", at the time, 230 pounds. I'm like, let's strap him up here. Let's see what happens. So yeah. So we strap him up there. I have like every single person in the department because I'm thinking this could be a disaster, right? If he falls down.
Yeah.
And
right.
Everybody around me, I strap him up there. We basically lift him on top of this treadmill. And I'm like, well, what they do with the cats is they took their little feet and they started moving them to help him move. Then all of a sudden the cat started moving their legs on their own. So I said, well, let's do that with this guy. Anyways, long story short, we started to do that and he started to step. And we used this, this research and we got him to walk again. And to this day, he can walk. He needs a little bit of help, but he definitely can walk up to 150 to 200 feet. So the evolution of research and approaches to treating spinal cord injury from that day on really started to rapidly change. Now that gentleman that I worked with, who is the hardest worker I've ever worked with, ended up becoming very good friends with me. And he is a business guy, CPA, and we ended up opening the recovery project together. That's my partner.
Oh, nice.
So he is, yeah, it's a great story, but he is the brains of the finance side of the company. And I came into the company with a lot of knowledge of rehab. And so we decided, let's join our forces and start the recovery project. So now we have 3 locations, one in Livonia, one in Clinton Township, one in Lansing. We have over 115, maybe 120 employees. And we now, which we started with just seeing spinal cord people, we now have multiple programs where we see people with spinal cord injury, head injuries, stroke, Parkinson's, MS, neuromuscular disease, oncology, which we're going to talk about in our next time. It's a great, great program. We see musculoskeletal injuries, orthopedic injuries, sports injuries. We see pediatrics. So we are this specialty center, and we are one of the biggest outpatient neuro centers in Michigan. So we really do specialize on all of those things. So today, though, as we've been saying, I want to take this opportunity to talk a little bit more and dive really deep into spinal cord injury. I mean, that is my love that I've been doing for years, and that's how we started. And I think it's really good timing. And I don't want to get on my soapbox, but I'm going to say one thing. You know, for us in this field and for you guys out there, some of you may be affected by the law of the change of the no-fault law. And some of our patients that have spinal cord injuries have been in a car accident and unfortunately suffered a spinal cord injury. And they are really struggling right now with the change of this law in dealing with the changes of reimbursement, the changes in attended care, the changes in therapy and what's covered and not covered. So I thought this is a really good time to talk about this topic, because there may be some people out there that are struggling and may hear something new, and very hopeful that there still is treatment out there to help them recover. So let me talk a little bit about our program. All of our clinics see spinal cord injury. We are a rehab center. We do outpatient. So the patients come to us and we have multiple disciplines. So we have physical therapists. We have occupational therapists. Now, a lot of people say, well, what's the difference between PT and OT? PT, in general, we work on mobility. We're going to get you moving again. You know, if you have the capability to walk, we're going to work on walking. We're going to work on your balance. We're going to work on you getting to move your arms and your legs so you can move yourself, transfer yourself, exercise yourself, work your heart, your cardiovascular system, all your muscles, ligaments, and take care of your bones. Now, occupational therapists do that as well, but their focus is on returning people back to doing their ADLs. ADLs are activities of daily living. So what
does that include?
Yeah. So like you guys for doing home care, this is what you guys do with those patients, right? I mean, it is learning to dress yourself, which seems so simple, but super important, because it's an everyday thing that now, prior to the injury, was, okay, I'm going to put my shirt on, I'm going to put my socks on, put my shoes on, and I'm off going. It is being able to use the bathroom. If it's showering, bathing, taking care of bowel and bladder, it's being able to do that by yourself. It's being able to wash your hair, brush your hair, curl your hair. Women, we know it's terrible for a woman that has an injury. And, we all use those stupid brushes and the hair thing. And
that's right.
I mean, these OTs are incredibly creative, but, going back to doing those kind of things, as well as being a parent, taking care of your children, taking care of your house, cooking. Not that women are stuck doing those things, but I personally love to cook and do those kind of things. But it's really getting back to doing those activities of daily living. So we have
feeling normal, right? Feeling more normal.
Well, feeling normal. And, what do we do as an adult and being able to function as an adult? Absolutely. Absolutely. So we have, and, in our OTs, we have many of them on staff, and they're very, very creative on site. They'll do cooking. It's awesome. They'll have people that they're working on, learning to put their makeup back on, doing those kind of things. So we also have speech therapists. Speech therapists, yes, work on speech, but they work on cognition. So they work on memory, they work on judgment, they work on executive function, they work on swallowing, they work on voice volume, all that kind of stuff. We also have massage therapists on staff, because especially with spinal cord, we see people that are exercising all the time, and maybe they don't have this balance of all their muscles working at one time, and they may have pain. So massage therapy is really a nice modality to help manage pain. We also have specific trainers on staff that are used to and trained working with spinal cord injury. So that's kind of what we do. But what I want to talk about a little bit is back to the science. As I said when I started talking, is when I started in school, there was no science. We just kind of said, you're going to do this, and that's what we're going to do. Now there is science, and it's very important that our consumers, and I say our patients are consumers. For you guys that are, let me see. If you got, some of us, I can tell you, I'll just say I'm in my 50s, that there was a time in healthcare that we listened to, I'm not gonna say you never listen to your doctor, but our doctor would really orchestrate, you're gonna go here, you're gonna have this treatment next. And now it's really, a consumer environment where people are so educated. We have the internet. We can Google. How many times do you Google when you have a sore throat? I wonder what's going on. So, you know, people really are becoming knowledgeable of services out there, of different interventions in medicine that may be helpful for whatever the situation is out there. So I think it's important as a healthcare provider to educate our audience on this is what we know that works for spinal cord injury recovery. Right. So these are the things that you should be looking for, no matter where you are, where you go to therapy, to ask your therapist, these are the type of therapies you should be asking for. So let me first start with, there are things called clinical practice guidelines. So these are science research things that they have done with hundreds and hundreds of people that have proven this is reliable and effective with people with spinal cord injury. We are now seeing that insurance companies now will only cover PT if PTs are using these type of interventions to treat somebody with a spinal cord injury. So it's important, because what you don't want to do is get a denial from your insurance company and then you're footed with the bill, and that's not a good thing.
That's right. Yeah.
So one of them is that people that have an incomplete spinal cord injury, meaning their cord's not severed, that they have some sparing, some movement below their injury. So somebody may have experienced a C5, C6 spinal cord injury. So typically that means that they can use their biceps, but from the elbow down is weak and from the chest down is weak. But if you have an incomplete, you may have sparing where you can lift your leg up, but maybe it's not strong enough yet to completely support yourself in standing. The clinical practice guideline for ambulation is that the physical therapist needs to be working on ambulation. That even if you need help with ambulation, that PT needs to be working on ambulation at an intensity of moderate to vigorous. What does that mean? That means that the PT is checking your heart rate. That means that your heart rate is elevated to 70 to 80% of your max heart rate. So that means that if I'm with you and I'm your PT and I ask you, how hard are you working? The response I want to hear is, I'm working somewhat hard. You're breathless. You shouldn't be having a normal conversation and you're not. You should have an exertion to it. Right. The recommendation in research is that people should be doing, in a session of physical therapy, let's say it's an hour long, 70 to 80% of that hour should be working on just walking.
Oh, wow.
So how that's changed is, it used to be, and when I was taught, that to work on walking, we would work on the mat and work on exercises to strengthen the leg. Then we would say, all right, we worked on strengthening your quadricep. Now I'm going to get you up and walk. That is not what the evidence is showing now. If you want to improve walking, you have to be walking. And working at an intensity, meaning working forward, backwards, sideways, working on a treadmill, working on gait speed. So we get the treadmill going up fast, and we may harness you and move your feet for you. But working with different assisted devices, working on obstacle courses, but really working on walking the majority of the time. The second for spinal cord is that what they found is that everybody with a spinal cord injury should be working on their aerobic endurance. Aerobic endurance, all that means is that you're doing something continuously for at least 20 minutes. It could be an arm bike, could be a new step, it could be a bicycle, it could be swimming, it could be walking on a treadmill. And with our spinal cord population, it's really getting creative and how we can get them to do something continuously. And again, adding that intensity, moderate to high intensity. The only way to evaluate that is through the heart rate and using these perceived exertion charts. Keep constantly asking the patient, how hard are you working? Okay. But there is science behind that. There is also science that with aerobic exercise, there is a neurotransmitter. Let's just say there's a nutrient for our nerves. Let's just say that, called brain-derived neurotrophic factor. You don't need to remember what that is. That's a lot of long words.
Good.
But it is this chemical that's released with aerobic exercise that is released in our central nervous system. It bathes our brain, it bathes our spinal cord, and the release of this is only released with aerobic exercise. And what this does is this promotes recovery of the damaged brain cells, of the damaged spinal cord injury cells.
Nice.
So again, the importance of working aerobically at least 2 times a week. Now, there is also evidence that people with spinal cord injury should be working on strengthening all of the major muscle groups. So if you are a quad and you have some movement in your lower legs, the therapist still needs to be working on your lower legs. Again, working on an intensity. It needs to be somewhat hard. If it's too easy and I can do 100 reps, nope, it's not good enough. We need to add resistance at least 2 times a week. The other thing that's very, very interesting in spinal cord injury rehab, really in neuro rehab, is now the science is showing that when a therapist is working with somebody with a spinal cord injury, for example, is that we have to allow our patients to make a mistake. So with you guys in home care, you guys can also use this principle with your nurses, with your attendant care individuals that work in the home. So we always want our patient to be safe, but we also want them to make a mistake. For example, let's say I'm walking with somebody and I have them, we have a harness system. You guys won't have this at home, but we have a harness system. We want them to lose their balance, to feel like they're going to fall.
Okay.
That's registering to them. All right, I'm going to wipe out. I need to correct my own balance. And they have to learn that. If we don't allow our patients to make a mistake, they will never relearn how to do that activity. So
that is so
home,
great.
Yeah. So at home,
we see so many of them. Yeah.
Yeah. I mean, at home, if you're working on transfers, instead of constantly doing it 100%, I'm going to just move you. No.
Yeah. You know, so many times what we're dealing with is that they're so fearful of falling that they're going to like freeze up, which makes our job even harder to be able to, you know, get them to move over.
Yeah. So it's a very gray area because safety's number one. You never ever want somebody to fall, but you have to allow them to participate and feel that little instability, because that's how they will learn to become an expert in that task. And the science is supporting that. So again, it's just, and I say to my patients, did you feel that? Now you almost fell. So what we should have done, and you can use verbal cues, you can use a mirror, but you then explain what you should have done is if you had both feet on the floor flat, then when you stood up, you wouldn't have fallen forward. So it's giving that feedback of here's how you correct it. And then they can learn that. And as they start to move, it all comes together. So it's kind of cool. Right. It's kind of very cool.
Yeah, that's awesome.
You know, one of the things that I wanted to mention, and we're starting to see this kind of in the no-fault world, is that people that have spinal cord injury, a lot of people, most of the people do not have 100% recovery. So there is a form of permanent paralysis. If some people have a permanent disability, and because of that, people that have been injured 2, 3, 4, 10, 20 years, which we still see these people
Sure.
are at risk for secondary complications. One of the things is now that somebody has a spinal cord injury, they're still aging.
Yeah.
So we know with age, we are all at a higher risk for what? Heart disease, diabetes.
Sure.
If individuals with spinal cord injury have more of a sedentary lifestyle, obesity, which can cause other issues. We see a lot of osteopenia, osteoporosis, which with what you guys do need to know that, because these individuals could be at a higher risk for fractures because they're lacking that bone density, because they're not moving and not contracting those muscles on their bones. So one thing that we do know is that exercise and exercising with a skilled therapist, if it's PT or OT, that understands a spinal cord injury and understands these potential risk of secondary complications, can really design an exercise program, put people through an exercise program to prevent heart disease, diabetes, obesity, skin breakdown, osteopenia, all these other things that could result in a further disability or even death. Right. So it's very important that people understand that, you know, after 2-3 years after an injury, if you feel like I haven't had any more functional change, the importance to continue to see a skilled therapist that understands, yes, you have a spinal cord injury, but it's also these importance of doing these other components of health and wellness to prevent all of these secondary things, which they are at higher risk because of their spinal cord injury.
Right.
You know, in the CMS world, which is the Medicare world, that they have recognized this. There was a court case that went to the Supreme Court, and I want to say it was in 1993, and I could be wrong on that year, where it went all the way to the Supreme Court and they won. And what they won was that people that have a chronic progressive disease or a chronic disability, that through Medicare, that they will get paid for and can receive skilled PT, OT, and speech if it prevents deterioration of their function.
That's interesting, Polly, because, you know, we come across that so many times where, you know, we still hear this from some of the skilled nursing facilities that, well, you've walked 200 feet, so we're ending and you need to go home. So Can you help us understand that a little bit more?
Yes and no. And I'll answer it this way. You know, that is old school thinking. And, you know, many people have this fear that in Medicare world, they set caps.
Right.
For skilled nurse or for home care.
Yes. That's right.
You're only going to get this many visits, because after this many visits, the facility is, or the patient is at high risk of an audit. In outpatient, in my world, it's the same thing. There's a cap. Typically the cap that people can receive, I'm going to say 14 to 16 outpatient visits, but you also can see them longer. You can do that. You know, I'm going to knock on wood here, as long as the therapist understands how to document properly and truly is providing skilled services. I'm a licensed PT. If I'm seeing somebody that is quadriplegic with a C6 incomplete injury, for example, and they can't go to a Planet Fitness to do their exercise program because maybe the equipment's not accessible, maybe that patient needs physical assistance to pull weights, to have proper alignment while they're exercising, to adjust those weights, to adjust that program continuously to get that moderate and vigorous intensity. You can't get that when you go to Planet Fitness and exercise by yourself. That's why they need me with a license to do that, but you have to document that. And it's really a skill set that many therapists and companies don't really educate their staff on how to do. And it takes time. So you really need to find that advocate, is what I'm going to say for you, that is willing to do that. And it's the same in the new no-fault world, as we're seeing that with some of our chronic spinal cord injuries that have been receiving care for 20 years. And it was reasonable and necessary. And now with the new law, they're all being denied. So it's this process you have to go through to justify, to say, no, they required the skilled services for all of these reasons, and they are receiving care under the science that I just talked about. And what you're seeing is that in going through those processes, that the insurance companies are starting to listen and are agreeing. And that they understand that the CMS, which is Medicare, you know, is the hardest standard of any healthcare. And if they okay it, why wouldn't other people? But yeah,
they're trying to align with them anyways. So, you know, all their coding. So
exactly,
I think that would work. Yeah.
you know, one of the things I wanted to mention is that at the Recovery Project, when I built the company, you know, one of our core values is that we will treat with evidence. And I started it with that. And I always say, and Misty, you may agree because you own a company, is that the key to a successful company is to hire people that are way smarter than you are.
That's absolutely.
I have hired people that are way smarter than I am.
Yeah.
And I am so blessed that I have this team that is incredible, and they follow these core values of constantly being up to date on all the newest evidence and the newest science in what we do and what we're experts in, and constantly educating our staff and making sure that we use the science when we treat these people so that we continually see them, we can continually get paid, it's a business, and that these patients can continually get their services. So we do have some, you know, specialized equipment that we use at the Recovery Project. One of them is functional electrical stim. And in a minute, we're going to show a quick video, but it's electrical stim where we can stim each side of the body at the same time. We can stimulate up to 8 different muscle groups at one time and do a functional task. So for example, if somebody, you know, pedaling a bike, we can stimulate both sides of the body with stimulating the lower leg, the quadricep, hamstrings, the glutes, the back, in this pattern of movement. And with that, these patients are getting recovery. They're getting the repetitions they need. They're getting the intensity that they need, you know, and with this activity in spinal cord injury, it's helping with exercising their muscles. It's helping with cardiovascular. We just talked about that. It's helping with increase in circulation. If you have increased circulation, you have better skin integrity. If you have better skin integrity, you have less skin breakdown, which is huge. It helps with promoting bone growth, which prevents and helps with osteopenia and helps with those fractures that we talked about. So that's just kind of one modality. We use these harness systems, these body weight support treadmill systems, that when we work on that science of teaching you to walk, we have you safe. We have you harnessed up over a treadmill, and then we can move your legs so you can get the repetition, so you can get the intensity, so you can get the steps. What's really cool is that in the last probably 5 years, there's been a ton of research out on virtual reality. So virtual reality makes me a little dizzy when I do it, but it's those goggles. I don't know if you've seen those, but it's those goggles that our young kids are like all about, right? They did a lot of science on recovery of the brain and recovery of neuro disease and injuries, that if we put people in this virtual reality world, so you're not sitting like in a room I'm in right now, and I'm having somebody reach for an object and move it over here, that if you put this 360 virtual reality, that the sensation that people are getting into their central nervous system is so much better with less distractions, that you're getting more neuro recovery. So if you've ever been in one, you have no distractions of the outside world, and you have constant stimulation. So if, let's say we have this one program where somebody's pushing a grocery cart, and they're picking out groceries. And so we may say, I want you to pick up all the boxes of cereal as you walk down this aisle of the grocery store. So this patient is feeling themselves walk. They're getting that thing, I'm reaching and placing. They reach it, they grab it. There's a box of cereal in their hand, and they place it in their cart. So it's this stimulation of sensory, of thinking, I have to reach here and put it here, of moving your body. So we're getting all of that in one time. So we're seeing a lot more recovery in using virtual reality with neuro rehab. So it's super interesting.
Yeah, how cool is that?
Cool.
I'm wondering if we can connect that with Instacart, so that you're pulling it off the shelf, it could be delivered to your home. You know what I mean?
Yeah, you would. Maybe, right? I mean, you know, that's kind of the technology that they used when they first taught people to drive.
Oh,
right.
Okay.
The driver simulation is you would be in there, instead of putting you on the road and not killing people, they'd be like, all right, we're going to practice you right here. For
pilots.
It's awesome technology. We use it in all of our clinics, but it's really neat technology that is showing this advancement in neural recovery. And in nowadays, with insurance cutting us off sooner, with not having as many visits as we used to have, you really, I want to educate our audience out there that it's important that you find the most efficient and effective way to get treatment.
Right.
Because our dollars don't go as far as they used to. So I know, Krista, you have a video. Can you show it? And this just kind of shows some of the technology that can be used with spinal cord injury for our audience.
And I don't think there's any audio to it, is there, Krista?
No, and this is just, wait till she gets it going. One of our core values is hope starts here. And we've always said that. I mean, since when you follow science, there's always hope. And we are finding more and more as following the sciences that science is discovering that there is recovery after brain incident disease, after spinal cord injury. Absolutely. So this kind of showed, this is just one of our clinics. This is our Livonia clinics, but it shows you this, we're coming up on the Bodyweight support treadmill. And this is a harness system that we harness people up, and you can see this young lady's harness step. So she's not going to fall. Then we speed up that treadmill, and we speed it up pretty fast, like 1.0, 1.5 miles per hour. And we move their feet if they can't move their feet. But we have all kinds of different equipment. Our philosophy and our approach is that we see people in an open gym. Let me tell you, so motivating. So many of our patients can see other patients, how hard they're working, see other patients and how they do things. This is called the red cord, and it's just another way to work on strengthening. People that can't lift their body against gravity, we have ways that we can use different slings to get people to move. Instead of just, if you can move a little bit, we will find a way for you to move. Here's an example of some of that functional electrical stimulation. These are our cycles that cycle for your arm. You can see the electrodes and the wires coming off this gentleman's arms. We have it for the legs. That's my partner, Charlie, that I was talking about. But he is doing the cycle for his legs, which works his heart. This is a Gait Trainer, which people that are working on walking, and we are stimulating up to 10 muscles at one time to simulate walking. And again, he has the VR on. So he is using FES and he's using VR. And so is this gentleman for cycling. So instead of looking out the window, he might be cycling through the Alps and getting that intensity, going up a hill, then going down a hill. And again, this is another, he's using VR, working on balance. And so you can simulate this in a more real environment. And here's another FES. We use a ton of FES that even with exercise, as we said, we learned. We used to, if people had paralysis, we'd be like, we're not going to work that muscle that is not working. Now we add stimulation to it so that we can get it to contract, so that we can get recovery in that muscle. So that's just an example of some of the things that we utilize at the Recovery Project. One thing I wanted to add is that in this, if you guys are watching, there's a website here for the Recovery Project, and you can go on that. It tells you all about our programs. And I so appreciate this time that I have time to brag about what we do. I love talking about it. But how to become a patient, you can find us on the website, and you can definitely click on there and fill out a contact page. You can directly call us. We accept almost all insurances. So give us a call anyways, get a prescription from your doctor and come in and see us. We will evaluate you. We can talk about what you've done in the past. Maybe you're new, what we can do for you. And what everybody says to us is, wow, this place is so different. We've never done these kind of things in therapy. And I'm so pleased when I hear that. Again, it's not coming from me. It's coming from these awesome, smart people that I keep hiring that are so incredible at what they do. So that's kind of, unless we have any questions, that's kind of what I know about spinal cord injury.
So Polly, I mean, I have some questions, which is, you know, when from a home care standpoint, we're providing, assistance with those spinal cord injured clients in the home. Most of them are from a car accident. We've had some that have been in, a pool, injury, but for the most part. And we see a lot of times if they don't get therapy, we're having issues with, BMs where we have to bowel movements, as we say, we have to now medicate them more. And we see more of like foot drop, where their feet aren't flat anymore. And now we're having more difficulty. If we were able in the past to kind of lift do a lift and get them at least standing, we could pivot transfer to a chair, all that, so it affects more, I guess, systems, and you might know more of all the systems that it affects than just the things that you listed earlier.
Oh yeah, you are so right. I mean, it is crucial. What I always say, we may see people for 2 to 3 hours, 2 to 3 times a week. What happens at home is crucial. One thing I didn't go over is that in the principles of neuroplasticity is repetitions matter. And it takes over 10,000 repetitions to learn something new. So we may see them for an hour, and it is crucial when they are with your team that they follow through, not just lay in bed, not just lay in their lazy boy, not just go back in their chair and not do anything, because it defeats the purpose of going through therapy. And like you said, even if you're in therapy 3 hours a week, but you do nothing at home when they're with your team, you're not going to have that benefit. And you are going to see skin breakdown.
Oh yeah.
You are going to see the foot drop, the joint contractures. We can recommend, I want you to wear this night splint to prevent that. But it is important to work through function. If you are blessed to be able to do a stand pivot transfer, you need to be doing that.
Yes.
Yes, you do. And, to listen to your team and say, these are the things that we need to follow through with at home. The other side of that isn't just the physical, it's also the mental. I mean, we see that, and we all are nodding our heads, is that especially during these last, I'm going to say 2 years, with this pandemic, is this isolation, and we are seeing more depression, anxiety, fear. And let me tell you, the more that if you are stuck in your home for a reason, it is so important to be engaged then within your home environment. And that's something that your team is so good at, is let's do something, even if it's within the home, if it's going outside and just feeling the sunlight on your face and exploring nature a little bit, right? I mean, that is health right there. So yeah, I mean, it's, and we deal with that when people have depression, anxiety, it directly affects their ability to recover after a motor vehicle accident.
Sure. Oh, yeah.
So, I mean, I'm always like, the mind and the body's connected, and we need to have health on both aspects. And it's really having that movement, that human interaction, that going out and exploring nature as well. I mean, all of those things, they call them the pillars of health, right? Mm-hmm. are super, super important. So you are absolutely right. What we do, we can't do without you. And it goes the other way around. We are a team, and you really have to work together to have the best outcome for who? Our patients, our customers, our clients, whatever you want to call these wonderful people that we have an opportunity to help.
I love the idea of somebody going to outpatient, because no matter what, no matter how good therapy is in the home, it's just not the same,
Yeah, there's barriers. We always say that, we have looked at, doing some therapy in the home, and there's just some barriers. I mean, this fancy equipment you just saw, we can't be lugging that piece of equipment in your house. The other thing, just that process of going out is good for an individual. You got to get ready. You got to get dressed. You got to eat something. You're on a schedule. Humans need structure.
Yes.
Now, if any of you guys have kids out there, if you don't give structure to your kids or your pets, it's a disaster.
Right.
Yeah.
So we all need structure. So yeah, I agree with you. It's healthy. Let's get in the car. Let's go to therapy. You're talking to other people. You are having a different stimulation. Trust me, when you get home, you're going to eat better. You're going to sleep better. Your digestion, as you just said, your elimination is going to work much, much better if you move. If you don't move, just like all of that, nothing's going to move down there, and that's not comfortable.
Yeah, one client we had would get her hair and nails and go to dinner after. So it would be like, she always looked fabulous going home, you know, so.
Hey, that's quality of life. That's what it's all about.
Yeah.
And Polly, our caregivers can take our clients to come see you. They have
that's wonderful.
And they can transport them there. So another reason to call us as well.
Absolutely. My gosh, that is huge right now. We are seeing in this no fault world some difficulty with transportation. So I'm so glad to hear that. So absolutely, everybody, that is a plus right there. That's awesome.
Yeah. So I want to thank everybody for joining us on our first community education session. And I want to thank Polly for doing such a fabulous job and talking to us about those outpatient services of the Recovery Project. Krista, thanks for keeping us together and on time. And
so I just want to say one more thing. Our next Facebook Live is going to be November 9th. Put it on your calendar. We're going to talk about oncology rehab and just the change. This is an up and coming area for people that have all different forms of cancer, the importance of treatment before you have chemo, radiation, or surgery, during and after. It's just filled up a ton of information. So I'm excited to bring some people in to talk about that next.
Yeah, I'm excited to hear more about it. We were talking a little bit before we started today, and it's more being proactive in your health if you do get the diagnosis of cancer. So Krista, do you want to tell everybody a little bit about Relevar and how we might be able to help as well?
Yeah, absolutely. We're all about maintaining independence in your own home. We know that's a big thing, whether you've been in an auto accident or you have an elderly loved one or you're aging yourself. The biggest thing is recovery works well in your own home, and it's easier to live life in your own home and not, in assisted living if it can be avoided. So our caregivers come in and help with those activities of daily living and provide companionship and, play games and do the things that you want somebody in your home to do. And, it's really important. And like I said, we can help get you to your therapy appointments with Polly. But, we can work in conjunction together to do that. And I know it's really important for people out there to stay home. So you can always call us or go on the website, and I'd be happy to help you. Misty'd be happy to help. And we look forward to talking with you.
Yeah, well, thank you, everybody. And we do have some other upcoming speakers, events coming up over the next couple of months. And then we'll be back with the Recovery Project in November. So we'll look forward to seeing everybody soon.
All right. Bye, guys. Talk to you later.
Bye.